You're lying in a hospital bed. The lights are bright, the room is quiet. You've signed the forms, held your breath, and tried to stay brave. Then a nurse leans in close and whispers something, just a few gentle words that reach deeper than any doctor's orders. And after the surgery, after the pain, after the long nights alone, those words stay with you. They don't just help you heal, they help you change. For seniors facing surgery or recovering from illness, sometimes it's not medicine, but a simple truth that becomes the turning point. If you're over 60 and preparing for surgery, healing from one, or just want to live stronger after 70, stay with us. Tap like, hit subscribe, and share in the comments. What's one small piece of advice you've never forgotten? Your story might help someone else heal. You're lying in that hospital bed, staring at the ceiling. The lights feel too bright. The air smells like antiseptic. Your thoughts drift between worry and hope. That's when a nurse leans in, touches your hand gently, and whispers something that you don't forget. Your body will follow your mind, so think strong. It sounds simple. But what doctors and researchers have come to understand is that these words are far more than comforting. They're scientifically true, especially for seniors healing after surgery. Experts explain that the brain and body are deeply connected. When your mind expects strength, your body is more likely to show it. When your thoughts prepare for healing, your cells begin responding in ways that support that healing. But when your thoughts spiral into fear, hopelessness, or hesitation, the body slows down too. Studies show that seniors with a positive mental outlook before surgery are far more likely to experience fewer complications, less pain, and faster recovery than those who feel powerless or afraid. Doctors have observed that mental framing, the way you talk to yourself, the way you imagine the outcome, can influence everything from blood pressure and immune response to inflammation and tissue repair. In one major hospital study, seniors who believed they would bounce back tended to walk sooner, eat better, and leave the hospital earlier than those who felt uncertain or defeated. It wasn't magic, it was mindset. And that mindset affected how the body behaved under pressure. Recovery after 70 isn't just about incisions or medications. It's about energy. It's about willpower. It's about staying connected to the part of yourself that refuses to give up. Nurses who work with older adults after surgery often describe a powerful difference between those who mentally lean into healing and those who mentally shut down. The first group might groan, feel sore, feel tired, but they keep trying. They push the walker, they eat the meal. They say yes when asked if they want to sit up. And that's where the real healing begins. Experts explain that a strong mindset improves motivation, and motivation leads to action. It's those small actions, and sitting up in bed, flexing your feet, taking deep breaths, speaking up about pain, that protect you from setbacks. Seniors who stay mentally strong are less likely to develop complications like pneumonia or blood clots. They're more likely to follow through with physical therapy, and they're less likely to lose confidence in their ability to recover fully. Doctors also point to the effect of stress on the healing process. When you feel powerless, your stress hormones rise, and when cortisol stays high, it can slow down the body's ability to repair wounds, fight infection, and regulate sleep. But when you take mental control, when you say to yourself, "I can do this even if your body feels weak," you help turn that stress response off. Your heart rate steadies, your blood vessels relax, your immune cells work better. Your body listens to your thoughts and it adjusts accordingly. That doesn't mean you have to fake positivity. Healing can be painful, it can be frustrating, it can take longer than you expect. But thinking strong doesn't mean pretending it's easy. It means believing it's possible. It means reminding yourself, out loud if you need to, that this is not the end of your strength. It's the beginning of a new kind. Nurses often notice that one sentence, one whispered truth, can shift a patient's whole path. And that's why those words matter so deeply. Your body will follow your mind, because your body has gone through a lot, and now it needs direction, it needs encouragement, it needs a leader, and that leader is your mind. So if you're recovering right now, or if surgery is in your future, hold on to this. Your thoughts are part of your medicine. They are not powerless. They are not background noise. They are signals your body listens to with every heartbeat, every breath, every step forward. You may feel fragile, but thinking strong does not require physical strength. It requires choice. And that choice, to hope, to try, to keep showing up for yourself, may be the very thing that gives your body the power to rise, repair, and return to life fully. You are not done. And your body isn't done fighting for you. So think strong, speak strong, heal strong, because the path forward starts in your mind, and your body is ready to follow. You wake up after surgery, and almost immediately people start asking how you're feeling, when you'll be up, when you'll be back to normal. A nurse walks in with a chart. A therapist asks you to try standing. A family member gives you that worried smile. And somewhere in all that, a quiet pressure begins to build. A feeling that you're supposed to hurry up. But a nurse leans in and says gently, "Don't let anyone rush you. Your healing has its own pace." And that one sentence becomes the anchor you hold on to. Doctors explain that healing after 70 follows a different rhythm. The body is more delicate. Muscles take longer to regain strength. Bones take longer to fuse. Skin heals more slowly. And deep inside, the immune system works differently than it did in your younger years. Rushing that process doesn't make it faster. It makes it riskier. Experts have observed that when seniors feel pushed to recover quickly, they're more likely to skip rest, downplay pain, or avoid asking for help. And those decisions can lead to dangerous setbacks. Researchers from leading medical centers warn that post-operative complications are more likely in older adults who overexert themselves too early. When rest is skipped or movement is forced, too soon the body can respond with swelling, infection, or even internal bleeding. One wrong twist or step before a joint is ready can undo weeks of progress. But when healing is paced gently, with care and patience, the results are stronger and longer lasting. Nurses who care for seniors say that one of the hardest parts of recovery isn't the pain. It's the feeling of being behind. Behind the calendar, behind expectations, behind the people waiting at home. But healing isn't a race, and there's no prize for being the fastest. In fact, rushing can turn small delays into major problems. A wound that reopens, a fall that sends you back to the hospital, a setback that shakes your confidence. Experts also highlight the emotional toll of feeling rushed. Seniors recovering from surgery often struggle with fear, frustration, or guilt. Guilt for not being strong enough, frustration when progress is slow, fear that they'll never be fully independent again. But doctors emphasize that all of these emotions are natural, and they deserve space. Healing isn't just physical, it's emotional, and trying to hurry through it can leave those deeper wounds unaddressed. There's also a hidden strength in patience. Studies show that seniors who give their bodies time to rest and who treat themselves with compassion during recovery often report less stress, better sleep, and greater long-term mobility. Their healing may be slower, but it's more complete. Their minds stay calmer, their bodies respond better. Because healing with care means healing with wisdom. The people around you may mean well. They may be trying to help you get back to normal. But if their words or pace feel like pressure, it's okay to slow down. Doctors say that one of the best things a senior can do after surgery is to listen closely to their own body. If you feel pain, rest. If you feel strong, take a small step. If you feel uncertain, speak up. Let your recovery be guided by what your body truly needs, not by what others expect. You've earned the right to heal in your own time. You've lived decades. You've survived challenges before. This isn't weakness. This is wisdom. Healing too fast can take away progress that slow healing would protect. Your body knows what to do. Your job is to support it, not rush it. So if you're recovering right now, remember that the timeline isn't a deadline. Your healing isn't late. It's unfolding at exactly the speed it needs to. And every day that you choose patience, you're choosing strength, not the loud kind. the quiet, steady kind that builds from the inside out. You deserve a full recovery, not just a fast one. And the best way to get there, the safest, smartest way, is to give yourself permission to heal at your own pace, because this is your body, your healing, your time, and you're worth every moment of it. The surgeon finishes the last stitch. The nurses begin to clear the room. Machines are turned off. The lights are dimmed, and the hardest part seems over. But what many seniors aren't told is that this is just the beginning. Doctors explain that while the surgery itself is important, what you do after the surgery, the days, the weeks, the habits you build, can matter even more than what happened in the operating room. Experts have observed that outcomes for older adults aren't just shaped by the skill of the surgeon. They're shaped by what happens in the quiet hours after. Breathing, moving, eating, resting. These may seem like small, simple things, but they carry enormous weight. Nurses working in recovery wards say again and again that the patients who engage, who follow through, who show up for their own healing, even slowly, even gently, are often the ones who go home sooner, walk steadier, and stay stronger. In the long run, one of the most powerful examples is breathing. After surgery, especially under anesthesia, your lungs can become weak, fluid can build up. If you don't take deep breaths or use the small breathing tool they give you, called an incentive spirometer, your lungs don't fully expand. Doctors have seen how this leads to pneumonia in many seniors, a complication that can send recovery backward fast. But those who make the effort to breathe deeply, even when it's uncomfortable, help their bodies clear out fluid and regain lung strength faster. Nutrition is another critical piece. After surgery, your body is in repair mode. It needs fuel, real, nourishing food that supports healing. But many seniors lose their appetite or feel too tired to eat properly. Nurses often say that patients who eat even small, balanced meals early on tend to have fewer infections, stronger muscles, and less fatigue. Doctors stress the importance of protein, hydration, and vitamins in the post-surgery window. These are not extras. They're essentials your body is begging for. Movement also plays a major role. Lying in bed may feel safe, but doctors warn that too much time in one position leads to stiffness, muscle loss, and even blood clots. Experts explain that standing, walking short distances, or even just shifting in bed helps your circulation, prevents pressure sores, and reminds your muscles they're still needed. This doesn't mean pushing yourself too far. It means showing up every day with a small step, and trusting that those small steps add up. Pain management matters too. Some seniors try to tough it out, avoiding medication because they don't want to feel groggy. But doctors caution that poorly managed pain can stop you from breathing well, moving often, or sleeping deeply, all of which slow recovery. Experts encourage seniors to stay ahead of pain, not behind it, so the body stays relaxed and able to heal. This isn't about comfort alone. It's about healing efficiently and safely. Another overlooked part of post-surgery success is emotional care. Studies show that anxiety and sadness after surgery are more common than most realize. Feeling helpless, isolated, or discouraged can weaken your motivation, and that affects everything else. Nurses explain that patients who stay connected, who talk openly about how they feel, and who lean on support, whether it's a spouse, a child, or even a journal, tend to recover with fewer setbacks, because the mind and body recover together. What you do in the days after surgery is not about being perfect. It's about participating. Healing is not passive. Your body will work hard, but it also needs you to work with it. Not with big dramatic efforts, but with steady, thoughtful actions. One deep breath, one good meal, one walk to the window. These become the bricks that rebuild your strength. Doctors remind seniors that surgery is a reset, a moment your body is vulnerable, yes, but also open to transformation. The choices you make afterward shape how well you come back, and how fully you return to the life you want to live. There is power in those quiet days. Power to heal stronger, power to feel better, power to write the next chapter on your own terms. If you're facing surgery or healing from one now, remember, the work didn't end in the operating room. In many ways, it just started. What happens next is in your hands, and every good choice you make is a message to your body that you are still in this, still willing, still fighting, still moving forward. You've come through the hardest part. Now give yourself the gift of everything after, because what you do next matters more than you think, and it's never too late to take the next step toward your best recovery. Someone walks into your hospital room and starts speaking louder than usual, as if you can't hear. Another person rearranges your pillows without asking, tells you what you should eat, how you should rest, what you should stop doing. It might be a nurse. It might be a family member. And even if they mean well, it chips away at something inside. Seniors recovering from surgery often feel this shift, the sense that others are making decisions for them. A nurse noticing this once whispered a sentence that became life-changing. Say no to anyone who makes you feel small or dependent. Doctors explain that emotional strength is one of the most powerful tools in recovery. When older adults feel respected, heard, and trusted with decisions, even small ones, their healing improves. Studies show that maintaining a sense of control after surgery lowers stress hormones, reduces complications, and leads to quicker recoveries. But when dignity is ignored, or when a senior feels powerless, the body slows down. Healing becomes harder. Confidence fades. Experts have observed that this happens most often in subtle ways. A loved one hovering, a caregiver speaking about the patient instead of to them, medical staff making choices without explanation. Over time, these small moments create a message: you're not capable. And that message, repeated enough, becomes dangerous. Doctors warn that when seniors begin to believe they are helpless, they become less active in their care. They speak up less, they move less, they eat less. And all of this puts them at risk for slower healing, depression, and long-term dependency. Nurses who work with older adults have seen the difference when a patient pushes back, not rudely, but firmly. When a senior says, "I'd like to decide that myself," or "please ask me first," their tone changes, their posture changes, their eyes light up. Something powerful returns. That's not stubbornness, that's survival. Because independence doesn't mean doing everything alone. It means staying connected to who you are, a person with thoughts, preferences, and wisdom that deserve respect. Researchers from elder care centers emphasize that autonomy, the ability to make your own choices, is directly linked to better health outcomes in older adults. Even when help is needed, being part of the decision-making process makes all the difference. It strengthens your identity, it preserves your dignity, and it protects against a slow slide into learned helplessness, which can lead to depression, isolation, and physical decline. This doesn't mean rejecting help, it means choosing when and how you receive it. It means allowing someone to support you without letting them take over. Doctors stress that seniors who participate in care decisions, from what to eat to when to walk, tend to regain mobility faster and remain independent longer. Why? Because they're still invested, still engaged, still present in their own lives. One of the hardest parts of getting older is when others begin to treat you like a child. But you are not a child. You are a whole person. Your years have value. Your voice has weight. And if anyone treats you like you don't matter, like your thoughts don't count, or like your needs are in the way, it is okay to say no. It is not rude. It is not selfish. It is self-preservation. Doctors also point out that emotional well-being after surgery is tied to how empowered a person feels. Seniors who are made to feel like a burden often lose the motivation to get better. They stop trying. But those who feel respected, who are asked for their input, trusted with decisions, and reminded of their worth, tend to fight harder for their own recovery, because they believe they are still in control of something that matters, their own life. If you're healing right now or navigating a new chapter of aging, protect your independence fiercely. If someone tries to take over your choices without listening, speak up. Say no with grace, but also with strength. Because that strength, the strength of self-respect, is part of your healing. And no medicine, no surgery, no therapy can replace it. You are not small. You are not helpless. You are not done deciding for yourself. Say no when someone crosses that line. Say yes to the people who empower you. And always, always say yes to your own dignity. Because that's not just how you recover. It's how you rise. You're lying still in bed. The surgery is over. The anesthesia has worn off, and now everything feels sore, heavy. Even the idea of moving feels too soon. But then a nurse comes close and says something that stays with you. Start moving sooner than you want to. Even just a little. Not to push you, not to pressure you, but because movement, even the smallest kind, could be the turning point in your recovery. Doctors explain that in the hours and days after surgery, the body begins a complex process of healing. Tissues are repairing, blood is clotting, muscles are adjusting to the sudden stillness. And if that stillness lasts too long, problems start. Circulation slows down, muscles weaken, joints stiffen. Fluid can build up in the lungs. What feels like rest can actually become risk. Experts warn that after 70, the body loses muscle faster. And the longer you stay in bed, the more strength you lose, sometimes permanently. Studies show that seniors who begin gentle movement within 24 to 48 hours after surgery are less likely to develop complications like pneumonia, blood clots, or pressure sores. Doctors have observed that even short walks down the hall, sitting upright in a chair, or doing simple leg lifts in bed can make a difference. These small actions wake up the muscles. They remind your heart to pump. They keep your lungs clear. And most importantly, they send a signal to your body. We are not shutting down. We are rebuilding. Nurses who care for seniors after surgery often describe the first few steps as the hardest. Not because of pain, but because of fear. Fear that you're too weak. Fear that something will go wrong. But what they also say is this: those first steps, however shaky, are often the beginning of everything getting better. Because motion brings strength, not all at once, but day by day it returns. And every extra breath you take, every time you shift your weight or swing your legs off the bed, you are telling your body to recover, not retreat. Experts explain that early movement helps regulate blood pressure and prevent dizziness. It also reduces inflammation by improving circulation. And for seniors, it protects against one of the most dangerous hidden risks after surgery: muscle wasting. This process, called sarcopenia, happens faster in older adults, especially when they're inactive. And once that muscle is lost, it becomes harder to regain. Doctors emphasize that movement, even slow and assisted, is like medicine for your muscles. There's also an emotional shift that happens. Seniors who stay in bed too long often begin to lose motivation. They feel disconnected from progress. They start to believe that their body can't recover. But movement changes that story. Moving reminds you that you are capable, that you are not stuck, that this body, even in its weakness, still belongs to you, and it still works. Doctors often set goals after surgery that may seem small. Walk to the door, sit in a chair for meals, stretch your arms. These aren't just boxes to check, they are lifelines. Each movement improves digestion, boosts your immune system, and gives your heart the gentle workout it needs to stay strong. And every day you move, even just a little, your chances of regaining full independence increase. Nurses have seen it again and again. The patient who sits up the same day, the one who walks to the hallway before lunch, the one who pushes through the discomfort of day 2 just to try a few steps. These are the people who get better faster, who regain their strength sooner, who leave the hospital not just alive, but ready to return to life. If you're healing now or helping someone who is, remember this: motion is recovery. You don't have to run. You don't even have to walk far, but you do have to start. Because healing isn't passive. Your body needs your participation, your energy, your courage, even if it's quiet. You may not feel ready, but readiness isn't what matters. What matters is that you begin, slowly, gently, with support. Because the sooner you start moving, the sooner you begin returning to the life you want. One careful, powerful step at a time.